Hello friends, I'm sharing with you case of grade 4 placenta previa where we managed to salvage the uterus because doing internal ligation is not only sufficient but also it helps in controlling the bleeding before separating the placenta. So this is the first step of the surgery where we are dissecting the internal iliac arteries and ligating the internal iliac arteries of the both sides. So we use the posterior approach to expose the both the external and the internal iliac artery on the right side of the patient. Here you can see the external iliac artery going up and the internal iliac artery going down. Then we give a nick in the fascia of the internal iliac artery so that we can expose the internal iliac artery completely. Here we had, so I find dissection with the fingers and separation with the fingers the best way because not only you can palpate the blood vessels, you can also feel the pulsation at the same time, and it helps in identifying the blood vessels from the uh, veins and the ureters. So here you see we are taking the first step in tying the internal iliac artery. We are tying it on the left side, and simultaneously we will be tying it on the right side. Here we are taking a suture, a surgical stitch on the uh, internal iliac artery on the right side, and here you can see that the stitch being taken completely on the internal iliac artery. So, similarly, we will do the step. We'll go through the posterior approach on the other side and do a similar step. So, the internal iliac artery, if you have any doubt in identifying the internal iliac artery, one should move upwards to the bifurcation of the internal iliac artery. So, from there, you can trace the internal iliac artery down below. Here you can see that we have opened this on the other side, the right side. Sorry, this is the left side of the patient. Here you can see we are giving stitch and nick in the peritoneum, or covering both the external and the internal iliac artery. And we can see the internal iliac vein, blue structure down there. Here you can see the internal iliac artery being exposed and a stitch being taken through the internal iliac artery. Here you can see that we are removing the fascia of the internal iliac artery so that the stitch can be taken all around the artery. We have exposed the fascia of the anterior and the posterior artery, uh, and with the help of fine, with the help of scissors, we dissect the fascia along the line of the vessel, and then we put 30 degrees right. Uh, 30 degrees artery vessel. Here you can see there are minor oozes which doesn't cause much trouble. And here with the help of 90 degrees artery forceps, we are taking the suture on the right side. So this is the right side internal iliac artery. This whole surgery is going live, and we've managed to stop the bleeding in less than 10 minutes. Here you can see that internal iliac artery is being tied on the left side, and above it is the external iliac artery. And we have cut the stitch of both the sides. So this helps in securing hemostasis. Here you can see that we are doing now stepwise devascularization of the ovarian vessels which are coming into the broad ligament on both the sides. Then we will do the ascending branch of the uterine artery ligation. And sometimes we think that this is sufficient to stop the bleeding. But when we separate the placenta, the bleeding starts occurring. So before going to that step, we are doing stepwise devascularization of the uterus. This is the branch of ovarian vessel, which uh, which is arising from the abdominal aorta. So here you can see that the the artery and the vein be ligated on the right side. Now we go to the left side where we see that um, the uterine artery of the right side is being ligated here, as you can see. So it is ligated just below the incision of the uh, on the uterus given to deliver the baby. So this is the ascending branch of the uterine artery which is being ligated on the right side. You would wonder why is he ligating the uterine artery as he has already ligated the internal iliac artery, because these vessels do not stop bleeding completely only by internal iliac artery ligation. Here you can see that we are removing the we are taking a stitch on the uterine artery on the right side, and in the leaf of the broad ligament. Similarly, we will take a suture in the ascending branch of the uterine artery. Here you can see that the uterine artery is being ligated on the right side. Here you can see that the uh, ascending branch of the uterine artery being ligated. Now the next step is we try to remove the placenta and see how much bleeding is left. Now this is the test. As you will see that the bleeding doesn't stops on its own completely after removing the placenta, when the vault and the uh, here you can see uh, we are removing the placenta completely from the uterus, and placenta is morbidly morbidly adherent to the uterus, and when we come to the attachment of the placenta on the cervical end, you will see that there's a bleeding starts occurring torrentially. And see, we've come down. Here you can see, uh, now you can see once we remove the placenta, there will be torrential bleeding from below. You can appreciate that the placenta is morbidly adherent uh, to the uterus, or the lower part of the lower segment of the cervix. And once we remove the placenta completely from the central part of the cervix, you see that the bleeding starts occurring torrentially. So in this place, the best way is to stop bleeding if to give sutures in the bed of the myometrium. Uh, Here you can see, and another important place to give sutures is the cesarean previous site of the cesarean scar, because the tissue has become quite thin there, and to stop bleeding completely, we need the presence of um, we need the stitch the cesarean scar, as well as we need to stitch the myometric blood to ensure that the bleeding has stopped completely. This is the way the bleeding is stopped, and uh, in grade 4 placenta previa, especially in primary patient where we want to conserve the uterus for the well-being of the patient. Here you can see now the bleeding is completely under control, and whatever little oozing is there, we can let it be. And second is Uh, see, now you can see that the uterus and where my scissors are, that is the area of cesarean scar. And there you see how much the blood loss which has occurred is less than 450 ml in the whole surgery. Thank you.